Assalamu alaikum. Hello everyone. I am Dr. Nur Mohammad Khan Mubin, Assistant Professor, Department of Microbiology, Bashundhara Ad-din Medical College. Today I am going to discuss about Salmonellosis. Salmonellosis, which are called the genera Salmonella, are a major cause of foodborne infection in worldwide, and it is this Salmonella can infect virtually all the animals. Now about 2000 serotypes are identified yet. Among them, only few serotypes can infect the human, and these are Salmonella typhi and Salmonella paratyphi. And Salmonella Dublin causes infection in the cattle, and Salmonella gallinarum and polorum causes infection in the poultry. And now the morphology of the Salmonella. We know Salmonella belongs to the Enterobacteriaceae. Enterobacteriaceae contains some special characteristics, such as they are catalase positive, oxidase negative, non-spore forming gram negative bacteria, and this Salmonella belongs to the Enterobacteriaceae family, and this Salmonella is gram negative non-spore forming bacilli and motile with peritrichous flagella, and it can survive in refrigeration, freezing and drying condition, and killed at 60 degrees centigrade for 2 to 6 minutes or 70 degrees centigrade for 1 minute, and it is sensitive to most disinfectants. Now the antigenic structure. It has got Salmonella has got O antigen, which is polysaccharide in nature, H antigen, which is protein in nature. H means flagella antigen and O means polysaccharide somatic antigen, and this H antigen is diphagic in nature, and there is also VI antigen, which is polysaccharide in nature, and it is heat labile. Now the determinants of pathogenicity. The surface antigens such as O antigens, which helps in the attachment to the host cell, and the VI antigen, which prevents the intercellular destruction within the phagosome. There is other things such as invasiveness of the Salmonella, production of the exotoxin such as enterotoxin and cytotoxin, as well as release of endotoxin. These are the determinants of pathogenesis of Salmonella. Now Salmonellosis, it can occur in several forms, such as it causes enteric fever, also known as the typhoid fever, as well as enterocolitis, non-typhoidal bacteremia, and may produce carriers state following Salmonella infection. And this carriers state is a source of infection for the community. Now the enteric fever, which is caused in the human by Salmonella typhi and Salmonella paratyphi serotypes, and these typhi and paratyphi has only human reservoir, as this species doesn't infect the other animals. For this reason, human are the only source of infections, and typhi and paratyphi transmitted through blood, food contamination and water contamination. Now another form of Salmonellosis is enterocolitis, which is caused due to the consumption of contaminated food such as eggs, poultry and dairy foods, and this causes invasion of the colon and small intestinal cell, and which is in self-remitting states. That means within 2 to 5 days it can self remission occur, and mainly occurred by the Salmonella typhimurium, which species is frequently identified during enterocolitis. Now bacteremia with focal lesion. Some species such as Salmonella coliaceus, Salmonella Dublin, and this causes bacteremia with focal lesion, and this focal lesion found in the lungs, bones and meningitis, and it is commonly associated with patient with chronic disease and or child with enterocolitis. Now the laboratory diagnosis of enteric fever. Specimens that are very much important for the laboratory diagnosis of enteric fever, because which type of specimen we should collect, it depends on the timing of presence of the patient to the clinician. In the pathogenesis of Salmonella, we can found first bacteremia occurs, then again second bacteremia occurs, and clinical manifestation is associated with the secondary bacteremia, and gradually it founds into the urine as well as into the stool. So, regarding culture, the most important specimen we have to collect is blood, urine, stool, and then other specimen that are not collected usually into our laboratory, but these specimen are more sensitivity specific is bone marrow aspirate. So, now the blood culture which is sensitive and specific, more sensitive and specific in first week, that is 70 to 90% sensitive in first week, and its sensitivity gradually decreases to 10 to 15% at the end of the third week. Now, the urine culture, we can do urine culture at the end of the second week, as well as the stool culture we can do it at the end of the third week and at the fourth week. In the at the end of the third week and fourth week, the sensitivity and specificity more in regarding stool culture, and we can do a serological test during at the end of the first week and during second week. It is called Vidal test. Now, blood culture we can do in different ways. The common frequently method used is called the conventional blood cultures. That means a liquid broth such as Streptococcus pyogenes is used to incubate the blood sample overnight, and after 24 hours this liquid broth is this liquid will contain the blood again subcultured into the blood agar media and McConkey's agar media. We know McConkey's agar media is a selective media for the gram negative bacteria as well as differential media. So, we can identify the Salmonella easily into the McConkey agar media, and we can also use other methods of blood culture such as lysis centrifugation method and automated blood culture method. In automated blood culture method, the growth of the organism decreases the pH as there is metabolism. For this reason, during growth of the bacterium multiplication, pH decreases, and due to production of carbon dioxide, and it is indicate the blood the bacteria is present into the blood, and we can identify the bacterial species after subculture. And we can do stool culture, urine culture, and the most sensitive specimen for identification of Salmonella during enteric fever is the bone marrow method, which is not frequently used into our laboratory, because bone marrow aspiration Vidal test, and it is the most frequently used serological test for identification of the Salmonella. And here H antigen and O antigen regarding Salmonella typhi, and A antigen and OH THBH, which is regarding the Salmonella paratyphi A and Salmonella paratyphi B. And here the significant titer, the baseline titer is 1:80, and the significant titer is 1:160. First, and this titer is the rising titer we can found gradually in the course of the disease. The first detectable, it is first detectable into the 7 to 10 days of illness. The high titer, that is 1:160, suggestive of active infection regarding O antigen, and the fold for rise of the O or H antigen or both is always diagnostic. If the O antigen titer is 1:320, and it is diagnostic in appropriate clinical settings. If the initial titer of the H antigen if it is 1:640, then it is strongly suggestive of active infection. If the titer is H, if the titer of the H is 1:160, it is suggestive of past infection and active immunization, that means vaccination or previous infection. So, H, we know H antigen means flagellar antigen, and O antigen means somatic antigen, which is polysaccharide in nature. For this reason, always O antigen, antibody against O antigen is always IgM type, and antibody against H antigen may be IgM, and in past infection it is always IgG. Now, the treatment, mostly it is after diagnosis we can use quinolones such as ciprofloxacin or third generation cephalosporin such as ceftriaxone. Nowadays, the resistance against ciprofloxacin or nalidixic acid or other quinolones is more frequent in case of Salmonella. For this reason, the clinician use ceftriaxone, that is third generation cephalosporin. And for enterocolitis, we can, as it is a self-limiting disease, we can only use fluid and electrolyte replacement. And in case of, if this enterocolitis is associated in chronic disease with neonates or other immunosuppressive person, then we can use antibiotic regimen. And for carrier states, we can use amoxicillin, ciprofloxacin, as well as cholecystectomy. Now, the vaccination. Kill type of Salmonella typhi, which is given in IM route, as well as live attenuated Salmonella typhi vaccine is available, which is given orally, and it is given in a schedule of days 1, 3, 5 and 7 with a booster every 5 years, and which gives 50 to 85% protection for 3 to 5 years. And there is another type of antigen, that is purified VI polysaccharide, which is given IM as a single dose 0.5 ml IM with a booster every 2 years. So, thank you all. It is in short about Salmonellosis.